Trigger finger surgery is a very common procedure. The good news is that recovery is usually pretty straightforward. In this video, I'm going to take you through exactly what you need to know from the moment you have your trigger finger surgery until the point where you can get back to work, and all the exercises that you need to do along the way. So if you've got trigger finger, then this video is for you. Let's get into it. After your trigger finger surgery, you're going to be given some kind of splint or a buddy tape. This is going to be removed after about 1 to 2 weeks. Once it's removed, you may notice that your finger is a little bit swollen. To help with this, you can put your hand in an ice water bath for about 10 to 15 minutes at a time, doing this 4 to 5 times a day. You can also use over-the-counter pain relief, such as paracetamol or ibuprofen. As the swelling goes down, you'll start to move your finger more and more. At around 2 weeks after surgery, you'll be given some exercises to begin. These exercises are really important to do to help get your finger moving and to prevent it from getting stiff. The first exercise is just simply moving your finger from side to side. Then you can progress on to making a fist and then opening it up again. As you get better, you can then start to do these exercises with the other fingers as well. And finally, you want to try and move the other fingers as well as your thumb, as you normally would. At around the 4-week mark, you should be able to make a full fist. And at this point, you can start to do some gentle stretches. You can do this by taking your other hand and gently pulling on your finger, holding it for about 5 seconds and then letting go. You can also use a rubber band to help stretch your finger. Place the rubber band around your finger and then gently pull it back. Hold for 5 seconds and then let go. You can do this about 10 times. If you've had trigger finger surgery on your dominant hand, you may be able to go back to work at around 6 weeks. If you've had it done on your non-dominant hand, you may be able to go back to work sooner. When you do go back to work, you may be able to do some of your job with your other hand, or you may not be able to do anything at all. It's really important at this stage to keep moving your finger and to keep it as straight as possible. You can do this by holding your hand out in front of you and then moving your finger from side to side. You can also move your finger into a bent position and hold it there for 5 seconds before straightening it again. You can do this 10 times. If you're finding it hard to do these exercises, you may have developed some scar tissue. This is when the finger feels a little bit tight and doesn't move very well. If this is the case, you can get some silicone gel and rub it into your finger. Leave it on for 10 minutes and then wash it off. You can also try putting some olive oil or coconut oil on your finger. I hope you found this helpful. See you next time.